Hi, Dr. Bushore here. I'm with Olivia, my medical esthetician. We're here to introduce our new Fraxel Dual. This is a great laser. It's not a new laser, it's been out a long time. It's the original fractional laser treatment. As you can tell, it looks like an old Apple computer, but this has amazing capabilities and amazing results. What's nice about it, it's called the Dual because it has two different wavelengths. So we can treat lots of different things. We use a 1550 wavelength that goes deep, and so we can treat like scars or wrinkling, things like that. And the 1927 is more superficial, so we can treat things that are more like pigmented, and it just more superficial exfoliation. What's nice is that this laser, it's non-ablative. So it's not making your skin raw. We do a topical numbing before we treat people so that, that helps kind of decrease any pain that you could feel because it is a kind of superficial treatment. I have an old scar from a biking accident that I can just show what it'll look like when we do that treatment so you can kind of see what it looks like. But it makes tiny little holes, and we can actually, I think, did you have like one of those little treatment cards? Mm-hmm. So we can, there's a little thing that we can roll across and you can see how it makes this little dot pattern. So that's what it looks like. And you can see with every pass that it starts to get more, you get a better coverage, and then you go back and forth. And this is what these little dots can look like on the skin. But as you can see, with every pass it gets more and more, and it's so you get such a good coverage that by the time you do all your treatments, all this overlapping, that you can't even see where the individual dots are after a while. What makes Fraxel different from other lasers, it's non-ablative. So it does make tiny little holes in the skin that are, creates energy that goes deep into the skin to help build collagen, but it does it in a non-ablative way, which means that you don't have raw skin. So it's nice because your skin stays mostly intact. It doesn't treat the entire surface of the skin, but that's why it may take a few treatments, but that's why your downtime isn't as bad. But by generating that energy deep within the skin is what tightens things up, does the collagen production. The more superficial treatment, the 1927, is better about getting more of that pigment and things like that to come off. But downtime is not bad. That's the best part about the Fraxel treatment, is you're getting an ablative result with a non-ablative treatment. So we have the two different wavelengths. We'll do the 1550 when we do like scar treatments. And then you can pick what depth you want to do, and that's kind of based on the energy settings. This is pretty thin skin. I'm not thinking we need to, like, this is what we use as setting for the face, so I'll probably go down to like a 60. Treatment level 7, so I can make sure I get good coverage. This is kind of what we do, and you kind of roll over in different directions, but I can have Olivia show you what that looks like. So it's kind of hard to treat myself. The interesting thing is that what this does more than anything is it can generate heat. And so to make it more comfortable, we use what's called a Zimmer chiller, and that's what this big hose coming down this thing is it blows cold air as it's doing your treatment. But you can see, there's just these little tiny rollers, and it only fires where these rollers touch the skin. So even if you push the pedal down, it won't fire until it starts rolling across the skin. I can show what this looks like. I'll bring this around. There you go.
Perfect, thank you.
And then you turn this on. So it gets kind of loud, but that's because of this blowing the cold air. All right, so we're ready to go.
Good one. So what's really awesome too about the Fraxel is that Dr. Bushore doesn't have to shave his arm beforehand. We can just go right over the hair. And so that makes it, really awesome for, treating areas of the face that might have a little bit of peach fuzz. So that's 2 passes there. So when Dr. Bushore was referring to, doing the 8 passes over the skin, perfect. All right.
And this is without numbing. I mean, it does get uncomfortable. I think the main thing is that it just builds. And so like you start counting, you're like 1 and 2, like that's okay. 3 and 4, you're like, ooh, that's starting to get warmer. 5 and 6, that's getting kind of hot. And then you're like, okay, 7, 8, that's enough, I'm done. And you will see it'll start kind of turning red, and then it gets puffy. And that kind of lets you know that you've kind of reached your end point there.
Almost done.
But you see how she goes back and forth, and that's to make sure that you got a good even coverage for that area.
And there we go.
And that's what it looks like when you're done. So it doesn't look that dramatically different. What will happen is that this is the interesting thing, because I actually treated my neck 3 weeks ago, and you can kind of see where there's some sun damage looking stuff over here, but I have this reddish area. It's called poikiloderma, which is a sun damage problem. Let me see if we can turn this off so we can hear better. But what happens is I've done laser treatments where I get the red out, so I make sure that I get the red gone, but it would keep coming back. And so I think the problem is I just had all this sun damaged skin that had gotten loose, and it just wasn't healthy skin. So I did the 1550 laser to go deep and try and heat all that up. It was interesting because I finished the treatment, and like the next day I'm like, it looks the same. And then a week later I'm like, it's okay, not that much difference. 3 weeks later I'm like, oh my gosh, this is making a big difference. You may be able to see like one little area back here that we didn't treat that's still kind of sun damaged looking, and it's still kind of atrophic, means thin and like sun damaged skin, and then how this is looking healthier next to it. So I was only one treatment, so I'm excited that the 1550 may take you, 4 to 6 treatments, they say, but we can usually use settings that you should see results, within less than that. And then the 1927, the one that treats brown and pigment, that sometimes you can be done in one, but 1 and 3. And if we have a lot of brown, we can even overlap it with our other laser, the Cutera, that helps get those browns really good, and then combine those the same day. So it's really neat that to have this option as a treatment for people, because it's a resurfacing procedure that's doesn't have a whole lot of downtime. Again, it's real easy to take care of. There's no raw skin. Downtime's about a week. When it heals, like you start feeling these little crusties on here, like the first few days. Around day 4 or 5 is when you're getting in the shower and you're just rubbing it, and it's like you're sloughing off all that dead skin. You're like, ooh, what's underneath? So great new treatment. Before and afters, you can go to the Fraxel website. You can see those. I have been treating several people. It's going to take a little time to see our before and afters, and we will publish those as soon as we get those. But just excited to be able to offer this to people as a great treatment option. Classic, the original treatment for fractionated, non-ablative laser treatments that can work great for lots of different indications: acne scars, sun damage, wrinkling, pigmentation. People don't like brown spots on their hands. People are starting to worry about like getting wrinkles on their chest. It treats all those areas. And it's safe actually for all skin types. So even for people who have darker skin types that are concerned about scars and the appearance of darkened scars and things like that, it can help lighten those up. We use conservative settings, or even fine little wrinkles and things like that. It can help with all skin types. So
if you have any questions, or you'd like to schedule a free consultation with myself to see if Fraxel is right for you, you can go ahead and give us a call at 512-459-4869. I'm Olivia Berry, licensed medical esthetician. This is Dr. David Bushore, and we're here at Balcones Dermatology and Aesthetics. Thank you so much.